Hi all, welcome to HUS Academy. Today we are going to discuss about a small question discussion which we been asking for the JC secondary examination. So let's get into this. So first question is, which of the following is an adverse drug reaction associated with cyclophosphamide? You all know that cyclophosphamide is an anti-cancer drug, right? So anti-cancer drug which is used in breast cancer. Primarily in breast cancer, the cyclophosphamide is used. In breast cancer, adriamycin and cyclophosphamide combination is given for the particular patient. Okay, so the cyclophosphamide main area is hemorrhagic cystitis. Okay, so other options are wrong. So we can learn what is the reason behind it. Okay, cyclophosphamide causes bladder inflammation. What does mean by cystitis? Because it causes inflammation, right? So it causes bladder inflammation. So to avoid that bladder inflammation in the patient, we are giving with mesna. Mesna means sodium 2-sulfonyl ethyl sulfonate injection. Okay. So if a patient is having breast cancer and we are giving with cyclophosphamide injection, we need to give with mesna to avoid what? Hemorrhagic cystitis. Okay. Next question. Antiplatelet contraindicated in patients with transient ischemic attack. So it is a direct question. Which antiplatelet is contraindicated? Contraindicated means which cannot be given to the patient with transient ischemic attack. Okay. What does mean by transient ischemic attack? Lack of oxygen in the brain death, right? So there are two options, prasugrel and dipyridamole. So the answer is prasugrel, which is contraindicated in patients with a history of stroke or TIA, that is transient ischemic attack, because of increased risk of significant or fatal bleeding. It causes fetal bleeding, so it may cause the rupture of the blood vessel. So it is not given with patients with transient ischemic attack or stroke. So moving into the next question. An old man has developed worsening hypertension despite therapy. So an old man, he is taking a hypertension therapy or he is taking a tablet for hypertension. So his physician wants to prescribe an additional medication that will dilate blood vessels to help lower his blood pressure. So his physician wants to add to that medicine with another medicine. So which of the calcium channel blocker that works primarily on vascular smooth muscle? So which of the calcium channel blockers? So below the options all are calcium channel blockers. Which one works primarily on smooth muscle vascular? So it is a direct question. You can give a hint here, right? That is vascular smooth muscle dilator. Here answer is amlodipine. We can see the answer with reason. So amlodipine is a dihydropyridine calcium channel blocker that primarily affect the calcium channels in vascular smooth muscle, specifically in systemic arteriolar smooth muscle. So it is given in the reason itself. It increases the dilation of systemic arterial smooth muscle, then dilate the blood vessel and decrease the BP. So, moving into the next question, cardiac glycosides may be useful in treating all of the following except. So, we all know that cardiac glycosides are given for the cardiovascular patients. So, which are the following disease condition in which we can't give cardiac glycosides? That is ventricular tachycardia, because digoxin toxicity is associated with adverse cardiac effects, right? So digoxin, when we giving with digoxin, it causes cardiac toxicity, right? So including ventricular arrhythmia. So if the patient is having ventricular tachycardia, we should not given with cardiac glycoside because it worsens its condition, right? So which are the most commonly seen in chronic toxicity? Digoxin induced ventricular tachycardia is associated with a high mortality rate since ventricular fibrillation or asystole may result. Okay. Next question is, gold standard for glomerular filtration. It's a direct question and simple question, right? We all know that inulin is a prebiotic which is cleared through glomerulus. Okay, so reason is urinary inulin clearance is considered the gold standard for measuring GFR because inulin has all the properties of an ideal marker. So it is an ideal marker for clearance rate determination. So it is a freely filtered by glomerulus. Who filtered the inulin? Glomerulus, right? So it is not secreted or reabsorbed or synthesized or metabolized by the kidney. So it can eliminate it through the kidney. So the clearance rate can be monitored. Okay. So these are the questions which we been asking frequently for the examination. Thank you so much for watching. Please like, share and subscribe. Follow for more details. Thank you so much.